While you add anything to the chat, I want to acknowledge that NCJW takes an expansive view of gender. We know that folks who identify as men can and do become pregnant, and that these people, along with LGBTQI and BIPOC individuals, tend to be those most impacted by restrictive rules surrounding reproductive health care. We serve as allies to and in coalition with organizations led by people in these communities, while leading the way on the Jewish perspectives on abortion. This is the fourth Repro Shabbat, an annual Shabbat celebration that honors the Jewish value of reproductive freedom. It takes place annually on Parshat Mishpatim, and this is the Torah reading, which contains the verses commonly referenced as the foundation of Judaism's approach to reproductive health, rights, and justice. Individuals and communities across the world gather to celebrate Repro Shabbat and the Jewish traditions it honors. And we have locally about 4 synagogues and Jewish organizations who are also going to be doing their own Repro Shabbat activities on Shabbat, which would be from this evening and through tomorrow evening. And it is my pleasure to now introduce Kiana Dunbar, who is a senior and University of Pittsburgh Elsie Hillman Scholar and NCJW intern this school year. This is the second year we've had a Hillman Scholar working on a reproductive project with us. Last year, we had Livia Lamarca develop a toolkit for students to help them understand and recognize crisis pregnancy centers near our campuses. And this year, Kiana's project has been gathering reproductive healthcare resources available to local university communities and working on the most effective ways to distribute that information to students, faculty, alumni, and staff. And I've been proud to be working with her. She's smart, organized, and committed to this project. I'd like to offer Kiana a few minutes to share what she's learned thus far and to offer a preview of the final project she'll be sharing with NCJW to add to our own list of resources that we can then share. This project is in process, so Kiana will share her discoveries to date. Kiana, go ahead.
Thank you, Kate. So as Kate mentioned, of course, this is a work in progress, but the purpose of this project is so that students don't have to go down a rabbit hole on school health plan websites, which can be really confusing when you're trying to find something specific. So I'm just gathering certain information that I would see as really useful to students to have easily accessible. So some of the things I've found so far, I'm finding information for Pitt, Carnegie Mellon, Carlow, Point Park, and Chatham University. So I want to have a section on general info about abortion clinics and CPCs in Pittsburgh, because I feel like that's something that not many people know about. The ratio of abortion clinics to CPCs is actually insane when you actually do the research. But yes, some things on CMU. CMU has vending machines, which is really cool, where they have affordable products like contraceptives, pain medicines, Narcan, fentanyl test strips, etc. I know Pitt is working on that as well, but I know CMU has that in function currently. And a number of student health offices offer peer health educators that host programs on various health topics for students and things like that, like things that I guess they wouldn't want to look up themselves. It's easier if you have people there in likeness with you trying to find out more information on similar topics. So yes, I've been finding information on these different universities. Most universities have no religious affiliation except for Carlow, which is a Catholic college. So there's some alternative research there, which kind of makes the packet more interesting. But as I'm continuing to finalize this, I'm going to be doing community outreach at the end of March and early April to different clubs and organizations on these various campuses, just trying to like get the word out as much as I possibly can. And like Kate said, this will be a packet that's on NCJW's website for people to access easily, for students to access, and also get the word out about NCJW and their work. So thank you.
That's great. Thank you, Kiana. I've been enjoying learning with you and from you. So I really appreciate all the time you've been putting into this. So let's dig into what's going on in Pennsylvania. Mostly I'm going to focus there. And then we'll do a little bit about what's happening nationally. We have just recently had a lot of success in our fight for affordable, accessible reproductive health care, including abortion, within the last year. So last summer, you might have heard, Governor Josh Shapiro announced that Pennsylvania would end its contract with Real Alternatives. Real Alternatives was one of the larger financial supporters of these crisis pregnancy centers that Kiana mentioned, and I'll go into a little bit of detail about in the Commonwealth, not just in Pennsylvania, but in a lot of states. And crisis pregnancy centers, or CPCs, that we often sort of abbreviate to, we often call fake abortion centers. They promote themselves as full service reproductive clinics, but in fact are unlicensed medical facilities. They sort of bill themselves as a medical facility, but they're not licensed. And they're often funded, mostly funded, by anti-abortion and frequently religious groups, with the goal to dissuade and shame people from seeking abortions. They do offer free pregnancy tests and ultrasounds, but with limited training and no medical licensure, they can provide inaccurate information. And the most importantly, I mean, I think really of concern is that they do not need to abide by laws like HIPAA. They're not beholden to those laws, and those laws protect sensitive medical information that actual clinics do have to abide by. There have been reported cases of CPCs informing a pregnant person that they are further along in a pregnancy than they are, in fact, again, to try to dissuade them. And there are cases where the CPC has, without permission, shared pregnancy details to abuser partners or to parents of minors. And again, this would not be allowed with an actual medical center because of rules for surrounding privacy, medical privacy. For over 30 years, Pennsylvania funded Real Alternatives despite allegations of privacy concerns and allegations of funds being funneled out of state. And between 2012 and 2017, the years we have the best data that has been compiled, Pennsylvania provided Real Alternatives with over $30 million in funding. We can extrapolate as to how much was given the other 25 years. Some of this funding came from TANF funds, or the Temporary Assistance for Needy Families. So in other words, because CPCs offered minimal supports, like free diapers, but didn't even always follow through on that, to those who carried a pregnancy to term, they received tens of millions of dollars of funds that could have otherwise gone to cash assistance, which is what these TANF funds are usually used for housing, food, job training, and childcare. Services that actually would have benefited those who wanted to expand their families or to support the children they already had. Governor Shapiro made reproductive access a key piece of his campaign. And in addition to the executive orders protecting providers and out-of-state abortion seekers, he wasn't going to continue the practice of funding Real Alternatives. He stated, Pennsylvanians made a clear choice by electing me as governor that they support a woman's freedom to choose. And the Department of Human Services Secretary Valerie Arkush said, the department has an obligation to ensure our contractors and partners are acting in line with these values and being good stewards of taxpayer resources. And we will not relent on this commitment. Following Michigan Governor Gretchen Whitmer, who ended Real Alternatives funding in 2019, as of December 31st, just this past December 2023, Pennsylvania also no longer funds the group. In its place, new grantees will administer what's being called the Women's Services Program, which is intended to advance accessible and inclusive women's healthcare, expanding access to comprehensive evidence-based care, support, and education across the Commonwealth that reflects the diverse needs of women here. New regionally based grantees include, and each of these grantees has a couple of regions, so so some of them, I'm listing them only once. It's Adagio Health, and that's the one that is providing services in Allegheny County. Family Health Council of Central Pennsylvania, Maternal and Family Health Services, and the Maternity Care Coalition. And all of these organizations will focus on prenatal care and postpartum supports, early detection and prevention of health conditions, parenting education programming, menstrual and reproductive health education and products, sexually transmitted infection testing and care or referrals, and referrals for assistance with other physical or behavioral health care needs. So much more comprehensive, much more supportive, and really a better use of these funds. So this was a big win that was a long time coming. And I want to take a moment to applaud all of you. For anyone who liked and shared our social posts, made a call to a Commonwealth legislator or the governor, voted for abortion-friendly leaders, donated to our organization, or talked up our Repro work. You were a part of making this change, and thank you. Without your support, we could not have engaged and been part of this change-making. We have worked in coalition with Women's Law Project, New Voices for Reproductive Justice, Representative Latasha Mays, who was the former executive director there and a current Pennsylvania legislator, Converge at the University of Pittsburgh, which is a coalition of providers, researchers, and allies, Planned Parenthood of Southwest PA, and our Elsie Hillman scholars, and even more to create this change that's needed to protect the lives, the livelihoods, the safety, and the economic security for all women in Pennsylvania. And for the most recent news, just last week, we received word that our own Pennsylvania Supreme Court issued a majority opinion and 2 concurring opinions that were direct rebukes of the U.S. Supreme Court Dobbs decision. That was the decision that overturned Roe, and it excoriated the arguments used to decide Dobbs, laying out a path forward that other states can use. This case was, at its essence, a Medicaid case about whether public funds can be used to pay for abortions, but it was so much more. And the decisions made in the case will benefit decisions about Pennsylvania repro cases and other cases, similar related cases, for years. Women's Law Project, one of our partners, served as lawyers for Allegheny Reproductive Health in their case against the Pennsylvania Department of Human Services. And just as an aside, it's actually funny because Valerie Arkush, who is the head of that department, is named as the person that Allegheny Reproductive Healthcare is suing. So even though Valerie Arkush was promoting this change about real alternatives as the representative of the Pennsylvania Department of Human Services, which is who oversees this Medicaid funding or not, she's named as the opposition on this case. So the original case sought on grounds of a violation of the Pennsylvania Equal Rights Amendment of the Pennsylvania Constitution. So Pennsylvania adopted the equal rights. As you know, if you want to have a federal constitutional amendment, a certain percentage of the states need to adopt it, and Pennsylvania adopted it in 1972. So we actually have more protections in our state constitution than we have at the federal level. This case, the original case for this Allegheny repro, sought on the grounds of a violation of the Pennsylvania Equal Rights Amendment that Medicaid coverage for reproductive health care is required. So under equal protection argument, Medicaid coverage, which has been denied in the past, is now required. That's what their argument is. So here's a quick legal history related to this case. At the federal level, after Roe was passed, came the Hyde case in 1977. Hyde barred federal funding for abortion except to save a pregnant person's life. States could then opt out to provide funding through state Medicaid funds. 17 states voluntarily did this, and others were required to via the courts, so via lawsuits like this one here. In Pennsylvania, Medicaid did not cover abortion under our 1982 Abortion Control Act, and it had exceptions for saving a mother's life, rape, and incest. And this is all changing with our current case. So in the majority opinion, PA Supreme Court Justice Christine Donahue stated, "To treat a woman differently based on a characteristic unique to her sex, i.e. pregnancy, is to treat her differently because of her sex, which triggers enforcement of our Equal Rights Amendment." She further stated that our adoption of the Equal Rights Amendment was meant to signal a sharp break from the past, a break we are now more fully recognizing over 50 years later. It is this piece that is in such contrast to Dobbs, where the legal precedent used came from men who lived centuries ago and who didn't believe women were equal to men. Justice Wecht in Pennsylvania, in the opinion, stated, "We cannot examine particular laws in their historical context without also examining the society in which those laws developed. The Dobbs majority relied on the patriarchal notions of eminent authorities of Old English common law, including Lord Matthew Hale, whose beliefs were driven by his goal of keeping women from encroaching upon the rights of men. Hale presided over the hanging of 2 women accused of being witches, thought that giving women legally enforceable rights over their own bodies was a threat to the freedom of men, and he also insisted that marital rape was never a crime because marriage amounted to the wife's, but not the husband's, irrevocable consent to sex. Hale's views frequently followed those of William Blackstone, another man referenced in Alito's Dobbs analysis, who believed that a married woman had no individual rights of her own. So the opinion written by our Pennsylvania Supreme Court just last month, just a couple weeks ago, really took apart the Dobbs decision and talked about why it was not a good decision. So needless to say, the sharp break that our Pennsylvania Equal Rights Amendment envisioned, the greater protections it affords than the US Constitution, would see abortion restrictions as an infringement upon the right of equal treatment under the law. Under the ERA, these restrictions are presumptively unconstitutional unless the state can prove that they are narrowly tailored to promote a compelling governmental interest. This means that the review of any restrictions that the Commonwealth might come up with will fall under the strict scrutiny test, so the strictest of tests for review of a law. So what the justice's opinion has said is that the banning of payment, Medicaid payment, is presumptively, the abortion restrictions are presumptively unconstitutional under the Pennsylvania Constitution. That doesn't mean that there can't be restrictions, but that any restriction will have this really strict review and it will be very difficult to overcome. Okay, so activism in this realm, I want to acknowledge, can come at a snail's pace. The Pennsylvania Supreme Court case alone, just this Supreme Court case, took 460 days from oral arguments to the decision being issued. Part of the reason was to wait for an election to add a new justice after the death of the very respected and beloved Chief Justice Behr nearly 2 years ago. And I'm sure the bench wanted to make sure that a full court made a decision on such a momentous case. So now there will be a myriad of cases brought and likely one that will expand access across the Commonwealth. But these cases will also take time. And again, your unwavering support, even when it seemed like nothing was happening, is what helped bring this really seismic and exciting shift about. In addition to a stellar brief, an amicus brief by New Voices for Reproductive Justice, one of our partners in this work, NCJW also provided an amicus brief, a supporting faith-based argument on this case. And NCJW Pittsburgh offered a program where we actually went to court to support Women's Law Project and listened to the arguments when they argued before the Pennsylvania Supreme Court. We were very lucky that the case was argued in Pittsburgh, and about 10 of us, along with many of our coalition partners, got to hear Sue Fritchie, the co-executive director of the Women's Law Project, and David Cohen, law professor at Drexel University, make compelling, cogent arguments laid out with strategic precision. It was a thrilling experience and felt like a win from the outset. And I was really happy that we were able to offer this as a program to our Repro network. So where are we? The case overruled a unanimous decision, a Pennsylvania case, the Fisher case, that had been in place for over 39 years, and says that abortion bans are sex discrimination and presumptively unconstitutional. But the opinion did not strike down the Medicaid funding ban. Instead, it remanded, sent back the case to the Commonwealth courts to rehear the case and determine if the state's laws banning public funding for abortion meet this strict scrutiny test that I mentioned. And it is a compelling governmental interest, narrowly tailored to achieve that interest that can't be done in any other way. The state's interest would be the health of the pregnant person and fetal well-being. So those are compelling state interests. The burden is on the state to show that for this case, sex discrimination should be allowed. And this is likely not possible. And we should see medication coverage probably in a couple of years, because that case, that remanded case, will have to go through the courts again. So in the interim, if you can support your local abortion fund so that they can continue to cover abortions for folks who can't afford it, folks who would be using Medicaid otherwise. If Medicaid or funds don't cover abortion, it's only available to some, putting those already at the greatest risk at even more risk. And the ripple effects from this can help bring down other abortion restrictions, as well as support pregnancy, trans, nursing and breastfeeding, contraception rights, and more. Okay, so in addition to this constitutional issue, the court also ruled on standing and intervention, and these are also really helpful to these repro cases. So in repro cases, providers often bring the cases on behalf of patients, which has been allowed under a standing exception. And standing is who can bring a case to court, like who has an interest in the case. And there's been an exception because usually the person directly impacted or an organization directly impacted has to bring the case. But there's this exception for providers, abortion providers, to bring cases for their patients. Anti-abortion litigators have tried to block this standing exception frequently, but courts, except in Kentucky, have said that providers can bring these types of cases. And it makes sense because patients may not want their privacy violated. These cases, as we have seen, can take years. While the patient has had their abortion and moved on, they probably don't want to keep revisiting it over and over. And here, in this case that was just released, the court agreed 5-1 that providers can continue to bring abortion access lawsuits. It doesn't have to be the patient. And one of the reasons this case did take so long to get to the Pennsylvania Supreme Court, and it was 5 years in total. The case was initially brought at the Commonwealth level 5 years ago in 2019. And part of the reason that it took so long was because over 20 anti-abortion legislators and interested parties intervened in the case at the Commonwealth level. And the PA Supreme Court said that these legislators have no special interest in the case and can't intervene in the future. So future cases, the providers will have standing and there won't be as many interventions. So that's great. So at the state level, this was a really big win. But there are federal cases and laws in the pipeline that could supersede this win. So as you know, federal laws supersede state laws in many cases. And the Supreme Court of the US is going to be hearing arguments on March 26th on the mifepristone ban in Texas that could severely limit medication abortion across the US. So here's some quick history again. Last year, a federal judge in Texas imposed a nationwide ban on mifepristone based on the argument that the FDA improperly approved expanded use of the medication. And that expanded use was things like allowing it up to 10 weeks of pregnancy versus a prior 7 weeks, allowing the drug to be mailed, to people. And this was especially concerning in Texas because abortion is banned there, and expanding the types of people who can prescribe mifepristone. Until Dobbs was passed and this lawsuit was brought, mifepristone has been used for 20 years in medication abortion. And the doctors bringing the case claimed that the FDA didn't take enough precautions to ensure the safety of women with the expansion of use. At the Biden administration's request, the Supreme Court placed a stay on the changes that the Texas court had imposed, and this allowed the medication use to continue until the Supreme Court issues a ruling on the Biden administration's appeal. Upholding the lower court's decision, this Texas decision would severely restrict access to medication abortion throughout the US, even in states where it's currently legal. So this is where it would supersede state law. That's if the Texas case is upheld. So mifepristone is one of 2 medications used for self-managed medication abortion. It can be done at home, in the comfort of your own home. And it, along with misoprostol, is used in about 50% of all abortions and has shown to be safe and effective. If mifepristone is banned or restricted, medication abortions can still happen using a misoprostol-only regime, but they tend to be more uncomfortable, these abortions. And they're also used in miscarriages as well, these 2 medications. So it would make it very difficult because doctors get confused and don't want to be prosecuted. So they probably just won't prescribe mifepristone, even if there are exceptions. So anybody who's using this medication for a miscarriage or for an abortion, they tend to be much more uncomfortable and they tend to take longer. So our own Shapiro administration at the state filed a strong amicus brief in favor of keeping the expanded use of mifepristone, and that came out just a few days ago. And we'll likely see a decision on this case this coming summer. And I just read that the publisher of the study that was used by the Texas doctors, who actually didn't have patients who used mifepristone, and again, this is a standing issue, but they claim their fear for women's health, and the case that the studies that they used to show that it impacted negatively on women's health. The publisher of that study just rescinded that study because they said it was not a good study. So I don't know how that will affect the case, but I thought it was kind of interesting and a little sad. So back in Pennsylvania, I just want to point out, it's important to remember that crisis pregnancy centers outnumber actual clinics still, offering surgical abortion and comprehensive reproductive health care by 12-1, and 87% of Pennsylvania counties have no abortion option in their county. Pennsylvania still has some of the most restrictive laws for abortion seekers and providers, and we still have our work cut out for us. There is some pending legislation that aims to increase access, such as House Bill 1786, which would prohibit Pennsylvania courts from cooperating with out-of-state civil and criminal cases involving reproductive health care services and prevent officials from other states from arresting individuals in Pennsylvania for abortion-related crimes. And there was legislation introduced in January, actually on the anniversary that that Roe was decided in the 70s. And this aims to remove unnecessary obstacles to safe abortion access by eliminating the requirement that abortion facilities meet the same regulations as ambulatory surgical centers and remove the excessive mandate that abortion providers maintain admitting privileges or have transfer agreements at hospitals which only block access to care. So we have an administration and a House that supports our efforts here in Pennsylvania. And I just want to say that these facilities requirements are called trap laws, and they were passed again as a way to restrict and make abortion access really difficult. And it imposed really difficult measures on clinics. They had to completely rebuild and reframe. They were very specific, like the hallways have to be X number of feet and inches wide, and there has to be this and there has to be that. None of these things are necessary, and they do not impact the safety or health and well-being of people using these facilities. They were just put in place to make it more difficult and to force the clinics that provide abortion to spend more money. So I'm talking about that we still have all these things to do, to get us to the place where we want to be. And here are some ideas, and I'm going to be emailing these out and including some links with all of these. There are some bigger lifts and easier lifts. So I just want to go through some of these ideas of ways that you can help. You can let Governor Shapiro know that what you want to see happen next. He just announced his progressive budget earlier this week, and that needs to be populated with bills for spending on his proposed funding. So you can let the governor's office know what you want to see and what there might be bills, like you might have something that you want to see, and there might be bills already along the way. And if you say, this is what I want, he might be willing to, more willing to sign those, more willing to push those, more willing to meet with caucuses on those issues. We here at NCJW sit on the Women's Health Caucus meetings, and they're receptive to our ideas. And this is a group of bicameral legislators interested in women's health. So people in the Senate and the House, the Pennsylvania Senate and House. And you can share what changes you'd like to see that impact women's health with us. And we can share it at these bi-monthly meetings. And this is a really fun way, because it feels like a direct way to influence proposed bills. Because we have the ears of our legislators every other week who are interested in women's health. You can write to your federal legislators to extend the timeline for adopting the ERA at the federal level. So, I talked about if we ever want to get the ERA, which was started in the very early 70s, passed as an amendment to our Constitution, the Equal Rights Amendment, X number of states need to adopt it, and we are not there yet. We still need a few more. I think it's 8 more. There is a timeline for when that process can happen. It has been extended several times, and we need to extend it again because we're starting to bump up against that deadline again, in which case the whole process would just end and we'd have to start over. I encourage you to read the Pennsylvania Supreme Court majority opinion and concurring opinions for their beautiful feminist doctrine. It is long, but it is a really lovely piece of court writing. And so if you have time, I think it's 216 pages, but it is beautiful. And it will make you feel good. You can follow us and support our efforts. We have, I think Rachel might be putting in the chat a link to to just a sheet of actions you can take that it was put together by our national organization specifically for Repro Shabbat. I encourage you, we took people to the Pennsylvania Supreme Court argument hearing. I encourage you to tune in and listen to the Supreme Court of the U.S. case on March 26th that will be they'll be hearing arguments about the mifepristone case. And we have a really great thing at the very local level that Mayor Gainey brought forth, and that is a form that you can fill out if you know of anyone who has been deceived by a crisis pregnancy center. And this is appropriately housed in their equal protection office. And I think Rachel or Heather can put the link to that in the chat as well. And this is just a great way for the county to, this is not Mayor Gainey, sorry. This would be, this is the county level, not the city level. But Mayor Gainey does support it and does promote it. So this would be Inamorata, but this is a great way for the county to track any issues with crisis pregnancy centers as they try to limit the ways that they can promote their what they do. And then last of all, you hear it all the time, but it's really important. Vote, vote, vote. Courts and elected officials matter, as we can see by all of these really beneficial improvements and changes that we have seen in the last year. It felt like nothing was happening for a long time. And then all of a sudden, with a lot of effort and a very long time of advocating, we've seen big change. We have 3 Pennsylvania justices who will be up, Supreme Court justices who will be up for election next year. And we're seeing how our courts have an impact. They've ruled on school funding, they've ruled on gerrymandering, and now this ERA case. So voting is really important. Change can be slow and incremental, and we'll continue to chip away at the barriers. We'll share links for how to get involved in a follow-up email. And I just want to take a moment here also to plug that the primary is not secondary. Our primary is coming up in April. It is for Jewish people on the first day of Passover. So if you are involved in celebrating that holiday, and it will be difficult for you to vote in person, I encourage you to now apply for a mail-in ballot, and as soon as the ballot comes, to fill it out and return it so that your vote gets in on time and gets counted. And for everybody, there are 16 polling locations and 40 precincts in Allegheny County that will be changing because they're housed in Jewish organizations and Jewish locations, and they will not be supporting those voting locations during Passover. So everybody needs to check their polling location. Everybody in Allegheny County needs to check their polling location to make sure you're going to the right place. And if you are voting in person, that you can do so quickly and efficiently. Thank you for joining today. Being here and learning makes you part of an informed community who can advocate for reproductive justice, the ability to choose whether to grow a family, whether or not to grow a family, and to raise a family in nurturing and safe environments. And that's for everyone. And as I wrap, I want to share the prayer for Repro Shabbat that our national organization has shared with us. And it's a lovely way to see the Jewish lens through which we understand abortion, and just kind of bringing it back to the Jewish aspect of it. Oh, you have it there with you? Okay, great. Oh, you know what? Where did it go on my? Okay, here we go. So, God of our ancestors, Elohai Avotenu ve'imotenu, we affirm that you have created each of us in your sacred image, endowed with the inherent right to dignity and autonomy. We ask that you guide us towards a caring and loving community and nation that reveres this dignity in each of us. We affirm that reproductive freedom, the sacred right to own the personhood of one's own body, is a fundamental part of the just society for which we strive in your name. We ask that you endow us with the strength and resolve we need, because the path that lays ahead is challenging and we all need resilience, strength, and courage. We ask that you protect the most impacted and marginalized among us, because it is they who are most at risk. We do this work in your name because we are compassionate, loving creations of a compassionate, loving, and just God. And this is holy, sacred work. May our country become a place of liberty and justice for all, and may our care for one another include care and respect for each other's right to good and affordable health care, including abortion care, and the right to live safely and securely as we each follow our path of conscience and the God that we do or do not believe in. And we can all say, if you choose, Amen. And have a peaceful Shabbat and weekend, and thank you for your time.